Psychiatry, pathology, personality disorders. All right, so personality disorders are essentially just like what makes up someone's personality, and they can be very severe. They're usually present by early childhood, and they're opposite to personality traits. Okay, so personality traits are like what makes you funny, or like, are you shy, are you introverted, or are you extroverted, are you loud? Those are non-pathological patterns of like behavior, and that's personality traits. Okay, so they're non-pathological, whereas personality disorders are pathological. They cause like a subjective distress or impaired functioning in like social settings. Okay, and there's 3 different clusters. The clusters don't matter as much. You don't really ask too much about certain clusters, but what they want you to know is about kind of each individual personality disorder. So we'll start off with cluster A, which is paranoid. So paranoid personality disorder is the idea that you have pervasive suspicion and distrust in people. Okay, so you have pervasive distrust and suspicion against everybody. You're hypervigilant. You're profoundly cynical about the world. Okay, that's paranoid, and it's correctly named, right? Because these people are severely paranoid. If you see like someone that comes in, and the question could be like, they're presenting to a doctor. Here, this is a good example. They come to a doctor, and they've had 5 previous doctors, and they say, they don't trust essentially anything that the doctor is saying. They have severe distrust and suspicion that the doctor is trying to do something to harm them or hurt them. Okay, paranoid personality disorder. Next is schizoid. Okay, schizoids do not like to socialize. Okay, so schizoid is just someone who prefers social withdrawal and solitary activities. All right, very straightforward, key, directly to the point. All right. Next is schizotypal. Schizotypal is the odd beliefs with eccentric behaviors. So if you see like a magical thinker, like if someone's like coming to the physician, they're like, oh yeah, like I have these healing crystals at home, and I go and do like Torah readings, and I get my healing from, feeling my plants, and, sticking my feet in like soil and mud, or like feeling my crystals. That's schizotypal. All right. I always think of like a crystal, like a crystal woman. And if someone that's listening likes crystals, I mean, nothing against it, but this is like an actual personality disorder. If you like crystals by yourself, sure, whatever. But this is like some woman that believes that she has magical powers because of like some type of crystals. Okay. That's schizotypal. So they have these like magical, eccentric thinking and behaviors, okay, with odd beliefs. Next is antisocial. So remember, we discussed that these antisocial personality disorders, this is cluster B now, but antisocial personality disorders is essentially the same as conduct disorder, but in adults, right? So conduct disorder is less than 18, but antisocial personality disorder is greater than 18. So they want you to know that. Now, they have no remorse at all. These are usually your... I'd say like this is your serial killers, okay? So they're probably going to go to jail. Most of these people with personality disorder, antisocial personality disorder, it's very sad, but most of them end up in jail. There's no real place or system in society for them. And so they most of the time end up in jail because of their criminality, their impulsivity. They're very hostile. They're manipulators. They're sociopaths. They could be murderers, stealers, right? They torture animals, things like that, okay? Antisocial personality disorder. Remember, it's in adult age, you're antisocial. When you're less than 18, it's known as conduct disorder, okay? Next is borderline. Borderline is kind of an inability to stabilize your mood, and they always have problems with like interpersonal relationships, okay? And so you'll always see like a pattern of unstable relationships. They always have mood instability and impulsivity. Those are very important for splitting or for borderline disorder. Now, splitting is a major defense mechanism for these patients. Okay, and that's something that they want you to know. So the way that you treat it is essentially, once again, dialectual behavioral therapy. So it's just behavioral therapy again. So you just discuss opposing views with these borderline patients. It's relatively high yield. Now, self-mutilation is going to be seen in borderline and increased risk, as well as suicidality for patients that have borderline personality disorder. But the key things I always look out for is pattern of unstable relationships, mood, impulsivity and instability, and self-mutilation, okay? Now, next is histrionic. Histrionic is like attention-seeking. Histrionic personality disorders like a lot of attention. They're dramatic speakers. They're emotionally expressive. They like sexual provocation is key to histrionic. They're very out there with what they say to other people, okay? They like to use their physical appearance to draw attention to other people. They're flamboyant, okay? That's histrionic. The last of the cluster B is narcissistic. Narcissistic, I'm sure it's named well because everyone knows what kind of narcissism looks like, but it's the idea that you are the best, grandiosity. You have the sense of entitlement. You deserve everything and no one else does because you are the best. And they lack empathy as well. But they also require excessive admiration from others. Okay, they have a very fragile self-esteem. Narcissistic personality disorder is pretty much, it's named well. And then last, we have our cluster C, which is one, avoidant. Avoidant personality disorder wants to socialize, but they can't. They're too scared or timid to do so. Whereas back in cluster A, when we're talking about schizoid, they don't want to socialize. They do not like to socialize. It's not an inability of can or can't socialize. They just would rather not in schizoid. Whereas avoidant, they want that need to socialize, but they can't. Okay, and that's very important. Obsessive compulsive personality disorder, we already discussed, but this is going to be egocentric or syntonic, okay, behavior. So behavior is going to help achieve your goal. It's consistent with your belief and attitude. So you have preoccupation with like perfectionism and control or order. So if that perfectionism bleeds into your day-to-day life of studying, then that can be egosyntonic, right? It's going to be helping you maintain or achieve that goal. And lastly is dependent. Dependent personality disorder is just like the excessive need for support. They're very clingy. They have low self-confidence, and they pretty much get stuck in abusive relationships a lot of the time. All right. Now, you're probably like, oh my gosh, Nate, there's so much going on. I'll tell you the ones that I'm pretty sure I remember getting questions on. Paranoid, I remember getting questions on. It's easy to understand. Schizotypal, okay, is like the odd crystal girl. Borderline is going to be like, it's once again, it's another one. It's the pattern of unstable relationships is high yield for that. And then avoidant is the want to socialize but can't. And they like to contrast that with schizoid, who just does not want to socialize. All right. Everything else, I don't really remember getting much question on. Oh, and antisocial. If I didn't say antisocial as well, right? Because they want you to know the difference between older than 18 is antisocial, less than 18 is conduct disorder. But pretty much everything else shouldn't be too high yield.